It is very nice to be here for different reasons. I want to congratulate the team for this very nice conference, John. I think if this meeting or this idea of conferences, sustainable development in the Mediterranean region did not exist, it would have to be invented. It exists, therefore, congratulations for it. I think the Mediterranean region is a region of the future. I am very optimistic about it for two main reasons. The first one is quite an obvious one, that is wonderful weather, but also because the amount of talent of young people. I have in my team a Greek young scientist working there, so really very sympathetic about Greece and about the prospect of this region. There are, of course, some challenges we see this morning, the various challenges we are facing worldwide and in Europe as well. It would be a mistake to believe that Europe is immune to this world challenge. We are not. We are in the middle of it. Therefore, the health sector here plays a key role. I think the pandemic, to which we do not have any fond memories, I don't think nobody remembers well the pandemic. We all suffer from it. It showed the weakness we have in our public health. It showed us how fragile we are and also how unsustainable some health practices are. We all remember that the lockdowns, we ate not so healthy, right? We did not exercise so much. We always gained a bit of weight during the pandemic. Some of it is weight now is gone, but we still see a trend in that because of lack of movement and health habits, packaged food, ordered food, diseases like hypertension has increased a lot in Europe over the past years, although things are now getting better. So there is a great connection between sustainability and public health. Which connection is this? The connection is the following. The health sector itself is very unsustainable. And that is so for a variety of reasons. The first one is the amount of waste produced by the health sector. Not only medical waste, but also material we use in single-hand gloves, materials we use and disposed of, that poses a problem. It is also a very costly one, because depending on how large a hospital is, they have to dispose between 2.5 tons every year of medical waste, which combined added expenditure to the hospitals. Also, the health sector is unsustainable as far as climate change is concerned. We don't immediately realize, but the health sector is responsible for about 4.6% of the global carbon dioxide emissions, 4.6%. To give a comparison, the aviation sector, airplanes, is 2.1%, and the shipping sector, 2.4%. So the health sector is responsible for more emissions than aviation and the shipping sector combined, which shows as much we can do, as much we should do to make the health sector more sustainable. What can be done? I think much can be done in respect of the purchase of medical products, in respect of handling these products, the best before date. I feel ashamed of the fact that in Germany, we've been disposing of COVID-19 vaccines because of the best date is expiring and lack of demand. So I'm praying that people will wake up to the need for keeping up the vaccination, get those jobs, and then increase their protection. By the way, you'd be very sad to know, dear colleagues, how many medicines, how much is being wasted every year because we're not really paying attention to them. So there's a need for really being careful about the use of meds. They are costly and they are a precious good, should not be wasted. A second matter is about plastic, which is very much used in the public health sector. We all know how serious the problem is of plastic waste, especially in the Mediterranean region, but not only, the amount of plastic going to the seas. That's why I'm very happy to see among the sponsors here, companies working in recycling. Well done. That's really, really necessary. And we also have to mobilize the public, which I think the most difficult thing, to sensitize the people about the need for being more careful in what they buy, in what they consume, because at the economy of scale, it makes a lot of difference. One of my acquaintances in Hamburg is the cook of a hospital. And the hospital budgets are very tight. I know it's like €3 per meal is the maximum they allow to spend, but he's been using the situation in a positive way. So it's offer more vegetarian food, more vegan food to the patients. It has been quite a positive feedback from them. So in essence, there's much we can do in making the health sector more sustainable. I think it's a question we should all be engaged, especially the pharmaceutical section, but all of us as well. I'll rest here, dear John, to make sure we have time for discussion.